Today we're going to discuss the ABCs of Original Medicare, also called Medicare Part A and Medicare Part B. So don't touch that dial. Hi, I'm Tim Hanbury, author of Medicare Blueprint. We find that many people are confused about how Medicare Part A and Medicare Part B work and what they cover. In this video, we'll explain more about the coverage you receive under Medicare Part A and B, what's known as Original Medicare. Be sure to stay tuned to the end of the video to receive our free offer. Now let's get started. Medicare Part A is usually described as hospital insurance, a term originally used when Medicare was introduced in 1966. However, this term can be misleading as Part A doesn't cover everything that happens in a hospital. It does help pay for the cost of inpatient care in a hospital or skilled nursing facility, hospice care, and home health care, but not long-term care. Part A could more correctly be called coverage that primarily pays for nursing care. It helps pay for the following: nursing services if you're admitted to a hospital or skilled nursing facility, or if you qualify and receive short-term home health services or hospice care at your home. A semi-private room in the hospital, meals provided by a hospital, and it will cover services provided by the hospital such as lab tests, prescription medications, medical supplies, and rehab services. Most other costs associated with your stay in a hospital or nursing facility, excluding physician charges. Medicare Part A also does not cover long-term nursing home stays or custodial non-medical in-home health care. Now let's look at the costs for services under Medicare Part A. If you're admitted to a hospital, Medicare pays all the charges except for a $1,340 deductible. And as you can see, if you're in the hospital for an extended period of time, there will be a per day copayment that can add up quickly. In most cases, you won't be in the hospital over 60 days, thank goodness. However, in many cases, they will transfer you to a lower cost facility such as a skilled nursing facility or rehab hospital. And as you can see, after 20 days, there are significant per day charges that can add up quickly. You are much more likely to exceed 20 days in a skilled nursing facility than spending over 60 days in a hospital. Now don't get me wrong, both can happen and both can have significant out-of-pocket costs to you. One thing that most people don't realize, unlike employer or individual insurance, the deductible is not an annual deductible. Under Part A, this deductible resets every 60 days. This means that if you go back in the hospital after 60 days, you have to pay the deductible again. And this is very different than the insurance that you're currently used to. People always ask us if Medicare Part A has a cost. And the answer is, it depends. If you and your spouse have worked at least 40 quarters or 10 years and have paid Medicare payroll taxes, then there's no cost to you. Because it's free, most people, in nearly all situations, should sign up for Medicare Part A when you turn 65. So now what happens if you don't qualify for free coverage under Part A? Well, you can still sign up, and if you've worked less than 30 quarters or 7.5 years, then you'll have to pay a monthly premium of $422. If you've worked more than 7.5 years, but less than 10 years, your cost is reduced to $232 per month. No matter what, you can always get Medicare Part A coverage. The cost will depend on your work history. So now let's talk about Medicare Part B and what it covers. Medicare Part B, what many people call medical insurance, helps cover doctors' services in outpatient care, physicians' expenses for inpatient and outpatient medical and surgical services. It also covers some other medical services that Part A doesn't cover, such as some physical, occupational therapy, and diagnostic tests. There is a wide range of other services that it covers, such as lab services done outside of the hospital, many preventative services like flu shots, mammograms, and everyone's personal favorite, a colonoscopy. Outpatient hospital treatments like emergency room visits and outpatient surgeries. Home healthcare services and durable medical equipment and supplies, and even some chiropractic care. Now there are a number of things that are not covered under Part B, such as routine dental, vision, and hearing services. Keep in mind that this is routine services that are not medically necessary. For example, we've had people call upset because they thought Medicare doesn't cover eye exams for their glaucoma or their diabetes. That's not correct. Medicare will cover these services because they are related to a medical condition. So you'll have to pay for routine exams for eyeglasses, but Medicare does cover other exams related to medical conditions. The biggest confusion is that Medicare Part B does not cover outpatient prescription drugs, and that's true. That is actually covered under Medicare Part D, which covers prescription drugs that you'll get at your local pharmacy. Okay, now let's look at your cost under Part B of Medicare. As you can see from the chart, Medicare Part B has a deductible of $183 in 2018. The good news is that this is an annual deductible, just like you're used to under your current insurance. This means that you pay the $183 one time, and then you don't have to pay it again. Then Medicare will pay 80% of your charges, and you'll pay the 20%. However, the 20% that you pay is unlimited, meaning that there's no cap on your out-of-pocket expenses for Part B services. That's why most people will get additional coverage to fill in the holes in original Medicare Part A and Part B. These Medicare plans, called Medigap, or also known as Medicare Supplement plans, can cover all or part of your out-of-pocket costs. You can also replace or transfer your original Medicare coverage with a Medicare Advantage plan offered under Part C of Medicare. We will cover these plans in a separate video. Medicare covers many preventative services at little to no cost to you. Medicare will also cover a one-time Welcome to Medicare physical exam. You must have this visit within the first 12 months of having Part B coverage. Make sure your doctor office knows that you're scheduling your appointment for your Welcome to Medicare preventive visit. This appointment is designed so your doctor can take some time and explain the benefits of Medicare. If you want to see a complete list, click on the link below. Now, let's move on to what you'll pay for your Medicare Part B coverage. In 2017 and 2018, the cost for Medicare Part B is $134 per month. Also keep in mind that it's important to sign up for Part B at the appropriate time. If you do this incorrectly, you will be charged a significant lifetime penalty. The last item that we want to cover is the income-related monthly adjustment amount, what is affectionately called IRMA surcharge. For people with high incomes, Medicare increases the cost of Medicare Part B coverage. The amount is based on your household income from 2 years ago. If you've had a change in your income, you can appeal the decision by going to the Social Security website. Medicare has a free publication that explains this surcharge as well as the appeals process. We've provided a link in the description below. If you have any questions, please comment and we'll reply, or we'll cover your question in an upcoming video. If you'd like to stay informed on everything Medicare, please subscribe to our channel. Thank you for watching the video, and as promised, click on the link in the description to get your free offer. Thank you.